All right, let's get right into it. Today, we're doing a full breakdown of a really powerful and common medication, finasteride. The goal here is simple, to give you a clear, no-nonsense look at what this drug is, how it works, and everything you really need to know about it. So to kick things off, here's a question for you. What on earth could possibly connect the hair on your head with your prostate? I mean, they seem like they're in completely different worlds, right? But it turns out they share a powerful hormonal link, and understanding that link is the key to this entire story. So here's our game plan. We're going to start with the two big problems finasteride is designed to solve. Then we'll pop the hood and see how it actually works. After that, we'll get into the proof, the side effects, some absolutely critical warnings, and then we'll wrap it all up by looking at the big trade-off. Okay, let's dive in. At its heart, finasteride is a prescription medication, and it's built to take on two very, very common issues that affect a lot of men, even though they seem totally unrelated at first glance. Now, the official name for its drug class is a 5-alpha-reductase inhibitor. That sounds super technical, I know, but don't worry about it. It's really just a fancy way of saying its job is to block one very specific enzyme in your body. We'll see why that's so important in just a second. So on one side, you've got male pattern hair loss. This is where the hair follicles on your scalp literally shrink over time until they just give up and stop making hair. And on the other side, you have BPH, which is an enlarged prostate that starts causing all sorts of annoying urinary problems. Two different symptoms, but believe it or not, they are both fueled by the very same powerful hormone. So how can a single pill tackle both of these things? Well, it goes straight for the engine that's driving them. To really get how finasteride works, you've first got to understand the hormonal process it's designed to shut down. Think of it like this. Your body has a little factory. The raw material going in is testosterone. Then this enzyme we just talked about, 5-alpha-reductase, acts like a machine on an assembly line. It takes that testosterone and converts it into something way, way more potent, dihydrotestosterone, or DHT for short. And this is the whole magic trick. Finasteride's entire job is to be a wrench in the works of that factory. It gets in there and it blocks that 5-alpha-reductase enzyme, effectively shutting down the production line that makes DHT. And just look at how well it does its job. By blocking that enzyme, finasteride can make the DHT levels in your body absolutely plummet. We're talking a drop of 60 to 70%. This massive reduction is the entire reason it's effective. Okay, so crushing your DHT levels sounds impressive, but what does that actually do? How does that translate into real-world results for hair loss and for BPH? Let's take a look at the evidence. What's pretty cool here is how the drug is used differently depending on the problem. For hair loss, you just need a small 1 milligram dose each day, and that's incredibly effective at just stopping the hair loss in its tracks. But for BPH, you need a stronger 5 milligram dose because the goal there is to actually shrink the prostate itself. Now, if we zoom in on the hair loss numbers, they're pretty staggering. We're talking about stopping any further hair loss for about 90% of men who take it. And on top of that, a really solid majority, somewhere around 2/3 of guys, actually see some visible regrowth. But, and this is a really big but, you have to understand that this is a long-term game. It's not a magic pill. You might start to see things slow down in about 3 to 6 months, but any real regrowth could take a year, maybe more. And here's the kicker. If you stop taking it, the factory just starts back up, and you'll likely lose any ground you gained within about a year. So of course, when you go and dramatically change your body's hormonal balance, that doesn't happen in a vacuum. There are potential risks. So now we have to flip the coin over and talk about the side effects, which, surprise, surprise, are directly tied to that powerful drop in DHT. So let's put this into perspective. The vast majority of men who take this, we're talking around 97%, don't report having these kinds of sexual side effects. But for that small minority, that 2 to 4%, these side effects are a very real possibility. So what are we talking about? Well, the most common issues are sexual in nature. Things like erectile dysfunction, lower sex drive, or other ejaculatory issues. Less common, but still reported, are things like breast tenderness or even mood changes like depression or anxiety. And now we have to touch on a very real and very controversial topic. It's known as post-finasteride syndrome, or PFS. And the concern raised by many patients is that for some men, these side effects don't go away when they stop the drug. They can linger for a long, long time. Now, at the same time, it is crucial to be clear about where the medical community stands on this. Right now, there is no broad consensus on what causes PFS or even how to define it. It's a very complex area that is still the subject of a lot of debate and ongoing research. Okay, beyond the side effects, there are a couple of warnings that are just non-negotiable. These aren't suggestions. They are absolute must-know safety rules for anyone even thinking about taking finasteride.
This is the big one. This is, without a doubt, the single most important warning. Finasteride is what's called a pregnancy category X drug. That means any woman who is pregnant or who could become pregnant must not even touch a crushed or broken pill. Why? Because it can be absorbed through the skin and can cause devastating birth defects in a male baby. This is an absolute hard and fast rule.
The second key warning has to do with prostate cancer screening. Finasteride actually messes with the test results. It artificially cuts your PSA score in about half. So you must tell your doctor that you're on it. That way they know to just double whatever your score is to get the true, accurate number. So, after all that, the science, the results, the risks, the warnings, we finally land here at the core question of it all. It's about weighing the pros and cons. It's the finasteride trade-off. And this really distills it down perfectly. The benefit? A remarkably effective treatment that gets right to the hormonal root of two very common problems. And the cost? It's a lifelong commitment, and you have to accept that you're taking on a real, even if small, risk of some significant side effects. And that leads us to the final, most personal question of all. Is that potential benefit worth the potential risk for you? Look, there is no right or wrong answer for everyone. It's a deeply individual choice, and it's a decision that you can only make after having a really honest, thorough conversation with your doctor.